I'm James Hamrick. I'm a medical oncologist and chair of the Caris Precision Oncology Alliance. The Precision Oncology Alliance is the manifestation of Caris's vision to not only generate point of care next generation sequencing tools to understand tumor biology, but also to share that data back in a collaborative way with collaborative communities to try to study rare diseases and not rare diseases in the cancer space and really bring together and nurture communities of researchers to use the molecular data to address important questions. One of the abstracts that I'd like to talk about that was presented at ASCO 2025 relates to mutant IDH gliomas. So, this is an important and sometimes devastating type of brain tumor, which is a fairly rare tumor. Historically, we know that mutant IDH gliomas actually tend to have a better prognosis than non-mutant brain tumors. However, there still remains some important therapeutic decisions to be made on these patients, which relate to prognostication of risk and prediction of response to therapy. Historically, we have used age, especially patients over the age of 45, as one of the defining features of high risk, and that impacts consideration of early chemoradiation. In this study, a collection of researchers from different institutions, led by Duke University, were able to look at tumor specimens from almost 600 patients with mutant IDH gliomas who had had next generation sequencing and whole transcriptome sequencing using Caris testing. They were stratified by age at diagnosis into four different categories. And the authors looked at real world overall survival during these different cohorts. And there were some really interesting findings. So while there were some differences noted in the cohorts in overall survival, it turned out when you did the statistical modeling and the univariate analyses of different variables, age actually fell out. So one of the takeaways here is that one of the variables that we've been using for this fairly rare disorder, which is age, actually probably falls out of the analysis when you're able to look at some of the molecular findings that you see in these tumors. So alterations in the genome, such as KRAS for oligodendroglioma and T53 and TERT for astrocytoma, were actually associated with poorer survival, and those held up in the univariate analysis. So this ASCO abstract demonstrated that NGS testing rather than age may drive prognosis for mutant IDH glioma patients and has real implications for the treatment of these patients.